I want this to be somewhat of an interactive talk. And for those of you, I'm a pediatric endocrinologist, so I have training in general pediatrics, but I specialize in endocrinology. And I'm going to try talking a little bit about transition of care as it relates to ALD. I love this cartoon, and I stole it from one of my fellows, and several of the slides throughout the talk I stole from one of my fellows. So at the beginning, I just want to define what is a healthcare transition, and then I'm going to spend a lot of time talking about the 6 core elements of healthcare transition. And then towards the end, I want to talk about how we should be thinking about this as it relates to ALD. And I think after Katie's talk yesterday presenting the challenges of follow-up in young adulthood, I think this is a really important topic for us now to be thinking about, as we have only 3 more states to get on for newborn screening, and we still need to get those last 3 on, but I think this will be important. So what is a healthcare transition? There are different definitions. I tried to pick out a couple that I thought were helpful. So it's the process of moving from a child family-centered model to a healthcare model to an adult patient-centered model of healthcare, with or without transitioning to a new clinician. So for a lot of people in this room, and the neurologists say, oh, well, I see everyone. I see the babies, and I see the grandparents, and I see everyone in between. So I don't need to transition my patients, but I'm going to try to make the argument that we need to be thinking about transition, because they transition outside of the clinic also, and that transition outside of clinic is where where a lot of people get lost. Another thought is the event or series of events through which adolescents and young adults with chronic physical and medical conditions move their care from pediatric to an adult care environment. So that's more of like a solid transition. And then the process by which adolescents and young adults with chronic childhood illnesses are prepared to take charge of their lives and their health in adulthood. So what are the goals? You want to improve the ability of youth and young adults to manage their own health care and effectively use health services. And you want to ensure there's an organized process in which the pediatric and adult healthcare practices facilitate the transition preparation, the transition of care, and then the integration of adult-centered healthcare. So why is this important? I think Katie really spelled out why this is so important yesterday, so I'm probably preaching to the choir a little bit, but it's important because you want young adults to be able to make informed choices about their lives. You want to foster the self-determination and planning. You want them to be prepared for healthcare management. You want them to be able to pursue their education, their training, their employment, whatever they want to do in life. And you want them to have the financial literacy and independence as it goes with this. And in the US, with our healthcare system, navigating it can be quite challenging, and preparing young adults for that navigation is really important. And then finally, we also want them to have a voice in the room and to be able to advocate for leadership within their health care communities. And then also, most importantly, avoid gaps in care at a particularly vulnerable time in their lives. So healthcare transitions is not something new. It's something that's been discussed for more than 2 decades now. And the American Academy of Pediatrics has been leading in this field. And in 2002, they came up with the 6 critical steps in healthcare transitions, which I'm going to go through here in a minute. But I want to just say the process has been kind of slow in general. I work in pediatric endocrinology, and one of my other hats is I take care of a lot of kids with diabetes, and there are a lot of diabetes centers around the country who've really taken a lead in this because there's such a high volume of patients who have diabetes going into their adult clinics. It's been a big need and to be able to address. I think in rarer diseases, it gets hard to find that big volume to get the buy-in, and I think this is part of the reason why I want to talk about it here, because we have a volume of people here who I think should take buy-in to this. So the 6 core elements to transition of care are spelled out here. Got Transition is an organization that has as their goal transitioning children to adult healthcare models. And about 10% of kids in the US will have a chronic condition that requires them to go through this process for that condition specifically. But truly, this should be done for every child leaving a pediatrician's office and going into internal medicine. So what do these 6 steps look like? And we'll go through step by step. So step 1, and the ideal time to start is thought to be around the age of 12. And with newborn screening, we're going to know about the diagnosis hopefully ahead of time so that we can be prepared starting at the age of 12, which we are now about to approach 12 years. So this is why I think it's also important we're talking about this right now. So at 12 to 14, the suggestion is that you just start talking about transition and preparation for it, what the transition policy looks like. So how do you develop a transition policy? It's something that takes everyone who's in this room. It takes lots of stakeholders, and we'll go through stakeholders in the ALD world. You need to have a thought about how your practice is going to approach it. You need to be able to have staff educated, and then you need to be able to somehow get that transition policy out to the patients and the parents so that expectations are set for this is what we're going to be doing over the next 4 to 6 years here in the pediatrics office. And then you need to be able to think about how are you going to track progress. So you need to be able to identify what are the things that kids need when they become young adults. And this is going to go, and then you have to come up with a way of tracking it. So in our practice for diabetes, for example, and I'll tell you about my fellow in a little bit, what she has done is she has created questions. She met with all of the stakeholders, parents, patients, our adult colleagues, our social worker, our psychologist, and we narrowed it down to what we thought were 8 critical questions and education pieces that we wanted our patients to have when they left our office. Those questions are now embedded in every single diabetes note that we write, and we can track if those patients are getting those questions asked and if they have retained the knowledge or learn, or if they've just been exposed to it or they still need to review it. And we know that so that every visit it's kind of hitting us like, oh, we need to talk about how do you order your medication, and that's something that we just need to make sure that they know. At 12 they don't necessarily need that, but that's something that as they're approaching college age, they're going to be going out in the world, you want to make sure that they know how do my parents order my medicine. Then you need to be able to assess their skills. And there are different ways of doing this. Again, this gets back to some of those questions that my fellow Sarah has embedded into our medical records, but you want to have regular transition readiness assessments. And I'm going to go through what a sample one looks like that's very generic, but I think that an ALD specific assessment is going to be needed. And then offer educational resources related to that. So if the family doesn't have that knowledge, you need to make sure that they're getting the knowledge. So the Transition Readiness Assessment Questionnaire is a general pediatrics questionnaire, and it's really hard to read, and they'll blow up some of these questions in a little bit. But I told you in 2002, the AAP came out and said, hey, you need to do this. But it took then another almost decade to come up with a validated questionnaire. So this is a validated questionnaire, but it's only validated for general pediatrics and not for chronic disease. And it's intended to be used by general pediatricians in their office to start asking questions to understand whether or not patients are actually ready for self-care. I tried to blow this up so people could read it, but I'm going to read through some of the questions and just kind of get you, so you have a flavor of what this looks like. So the first question is, do you fill prescriptions on your own? And the columns are, no, I do not know how to do this. No, but I want to learn. No, but I am learning to do this. Yes, I have started doing this, or yes, I always do this. And so the idea is that over time, you're progressing through these questions. Now, we had to make it simpler for practical reasons in our diabetes program. So instead of saying, do you fill your own prescriptions, we ask, do you know how to fill your prescriptions? Because that was actually the bigger thing, that they had no idea. And then it was, yes, they have it, they know how to do it, they can accurately tell you, and they know where they know their pharmacy, or no, I have no idea, or I've reviewed this with them, but they still need to have it reviewed a few more times. And so we do the assessment ourselves versus having the patients filling out the questionnaires or the parents filling them out. Moving along to the fourth element, this is developing a healthcare transition plan, including a medical summary. So this is where if the patients are leaving pediatric care and going to adult care is really important. If they're in the neurology clinic and going to stay that way the whole time, they may not necessarily need to have this summary, but it's probably helpful as they go from general pediatricians to internists to have it. If they're in family practice, family medicine practices will be able to see patients through childhood into adulthood, but a lot of kids do have to transition. So how do these plans look? So for me as a pediatrician, when I'm writing this, I'm writing out an assessment of how ready they are. So even if they don't have all those questions answered, if they're 22, they still have to go to the adult world in my hospital based on the institutional policies that we have. And so I write out for the adults, hey, just so you know, their mom's still filling their prescriptions for them, so you want to make sure you have mom's phone number, or like ask them permission or to sign off on a paper that you can talk to mom if you're having trouble getting a hold of them, or their prescription issues or insurance issues. You also need to write out what the long-term goals are. Like, is this someone who is in college? Is this someone who is working? And then give out specific information for the condition. So I have transitioned now a handful of boys with ALD to adult endocrinologists, and I send them the adult endocrinologist messages and say, hey, how familiar are you with ALD? I just want to make sure, here are some guidelines, here are some general things that you need to look out for. They're supposed to be getting MRIs once a year. This is their neurologist. And just so that the endocrinologists are aware, because most adult endocrinologists have heard of ALD when they were studying for their boards, but they may not have had a patient that they've actually taken care of. You also want to make sure that the youth and the parents are prepared as well. And I mentioned legal changes with decision making in here as being something that's really important to assess. There are some patients who are never capable of making their own medical decisions, and you may know that, the parents may know that, but legally that also has to be spelled out, and every state has different rules about it. In New York, it's usually a process that starts after they turn 17, so it's something to keep in mind as you're thinking about preparing patients for transition. And then also figuring out what the optimal timing is. Some institutions in pediatrics, they don't have the capacity to take anyone after 18. And they just, their clinics are overflowing, they're having trouble. And so 18 is kind of a hard cutoff, and they have to transition. So you want to try to have patients prepared before 18. I'm fortunate to be able to see patients later and up till 22, and so I try to work on that transition, because I find 18 to 22 to be particularly challenging with college and all the changes that happen after high school. You want to help also, for pediatricians, identify who's going to be your doctor, where are you going to live, who's going to be able to take care of adrenal insufficiency, who's not going to be scared about hearing the term ALD when you walk through the door. And then you do have to make sure, for me, that you have consent to be able to talk to the parents about the child's condition. And so just formalizing that can be really helpful. And then really taking into account preferences for the patient as you're going through this process. And then the next two steps are the actual transition of care. So you're going to for completing that transition, you'll put together a care packet. In our institution, we have separate, for endocrinology, we have a dot phrase and Epic, or our electronic medical record that drops down we have an endocrine one that's very general, because there are a lot of different conditions that we treat, but then we identify who the adult it's very helpful because we have an adult counterpart who will look at it and say, oh, so-and-so is more interested in reproductive health, and so we're going to pair them up. So they do try to have a warm handoff. With diabetes, it's a little bit more straightforward, but disease specific when the questions go out. We confirm the first date with the adult clinician, with our social worker and our administrative staff. And then it says prepare a letter with the transfer package. For us, that is a little bit more straightforward if it's someone in our own institution. If it's outside the institution, I try to make a call and do a warm handoff. And then you want to communicate any issues with the adult clinicians. So for me, adult clinicians are going to want to know about any issues that are going on as well. And for us, we will put in information if there's been any concerns with like social issues, but also just, hey, just so you know, this patient often forgets to refill their medication. They'll call you on a Friday night. You may want to just help them like set a calendar reminder when you see them, or make sure they have calendar reminders in. And then you want to make sure that patients are as stable as they can be when they're transitioning, that you've taken care of like any dose adjustments and confirmed that everything is where it should be. And then last part of this is just actually confirming the transition has worked and that it's not just, all right, my job's done, I sent that letter off, but it's following up with the adult providers to find out, hey, did they show up at the clinic? Did they get their MRI when they were supposed to? Was there something that I didn't teach them that they should have known? And this is really, really important, because as you go through transition, getting feedback from the adult side of things when you're a pediatrician is really helpful for us to be able to figure out what we need to do better on our end. So having the collaboration between peds and adults is really important. So what do we do for ALD? And I know, I apologize, these are kind of small, but the idea, I just went through our 6 core elements of what we need to think about, and then we need to have stakeholders. So stakeholders, I'll talk about a little bit on the next slide, and then we need to think about what we need for our patients to be able to do when they get into the adult world. So this is just my stab at trying to figure out who are the stakeholders that we need for ALD for this. And I just kind of put out broad categories, but truly I think everyone in this room needs to be involved. And even I would say newborn screening actually plays a big role in this too, because we were talking about women and reproductive health, and like thinking about how do we get that information to the 18-year-old who got their newborn screen, when they were an infant. How do we make sure that that healthcare information goes with them as they move into the adult world? So my idea is that we need to have stakeholders, that we need to have, if you're in an institution, you need to have senior leadership support for this. It takes time to build these types of medical record systems to be able to track. It takes time to be able to do feedback. but you need to have leadership involved to help you with it. You need to know about your institution and department policies. So, like I said, my institution is pretty good. We're allowed to see patients until they're 22. Other places, maybe 18. And then you need to be able to develop a process. And I think having the questions for ALD will be helpful, but the process is going to look different at Montefiore and at KKI and at MGH, because the people who are there in the adult world are different, and who's going to be taking care of the kids long term as they get to be young adults is different. And then I just have 2 last slides, and I really want to have more of a conversation. To be able to do this right, you really need to think about this as a quality improvement project. And it can be a quality improvement project across institutions, but you really have to think and plan out. You have to have some sort of measure for what you're doing. That measure can start with the education, and the kids who are not transitioning, I think the kids who don't transition through, physically from one clinic to the next, having an understanding of what their education is and what they know as they're turning 18, I think is going to be important. I think for those of us, and then you have to go back and assess, did those questions make sense? Were those the questions that we really needed them to learn? Are there more questions that we need them to be able to answer before they go? And then go back and fix them, because this is not something that I think, it's going to be dynamic. It's not something that we can just do once and then set it and forget it. I think we're going to have to learn about it. And hearing from young adults what their experience is really helpful. And then for the researchers in the room, while this is soft science and not quite the bench work and the lab mice, this can be research, and it can be something that you can look at outcomes, and you can take Katie's data and say, we only had, 38% got their MRIs, and with implementing a transition care, we got it up to 80% doing their MRIs. And you can publish this, it can work. In the endocrine world, there really isn't much for adrenal insufficiency right now. There's a lot of diabetes transition. This is one publication, though, that was done specifically for congenital adrenal hyperplasia, which is also another newborn screening condition that causes adrenal insufficiency. And this is one institution's process for it. But you can see they're starting at 12 with education. They're thinking about some of the psychosocial things that come up with the condition. They're asking the questions about making sure that they know how to refill their medications. They also have built into their process going back and doing genetic counseling again at 17, because this is a condition that's also inherited. And then they have a process, and in their institution, everyone transitions by the time they're 18. So it's just thinking about all the things that we need to think about with ALD and making sure we're including it. And that's all I really had to say. I really wanted to kind of hear from everyone what they wanted to do. I want to thank everyone again for being here. I love this cartoon. Again, I stole it from Sarah. Sarah is my fellow in the right-hand corner, and she's standing in front of her quality improvement project about introducing her STRIDE project, which was introducing questions specific for type 2 diabetes. And you can see she has her fishbone on the left with all of her stakeholders, and then she has a run chart in the middle of her posters, looking at different metrics related to diabetes education and preparing our patients as they go to adulthood. So I think this is something we should be doing for ALD also. And that's all. I don't have much else to say. I haven't implemented anything yet, but I'd like to have everyone. Yeah.
Thank you for that presentation. I have a question, but I want to tell a story first that's very relevant. So one of the best pieces of advice I ever got in my ALD 9 years of life came from you early on in my son's first year of life. And what you said was, don't hide the term ALD from him. He's going to grow up. He's one day going to Google it. You know, just don't be afraid of it. And I remember even just conversing with you how awkward it is when parents, you saying how awkward it is when parents ask you to kind of avoid the term. And I'm so, I don't want to get emotional, but I'm just so grateful because that really set a path for him and for us that helped even outside of ALD, you know, where I wanted to bring him when I got my first COVID shot so that he would, just so helpful. And I think it's really relevant to this presentation and this endeavor that we're likely taking on this year now. Because, so the transition of care is starting at 12, but because you gave me that piece of advice, I'm now not scared of this. I feel prepared as a parent at 12. So I'm curious in your practice and doing this with the diabetes patients, how hard this transition is when you have a parent that maybe has been trying to hide certain things. And I'm just thinking of some of the younger families in the room, and like I said, just how helpful that piece of advice was. Like, obviously the parents are a big part of this, regardless of what the pediatrician or the clinician puts into practice. So
so I think the parents are the main educator. You know, we spend all of our time training parents, but then we forget that kids grow up, and the parents end up providing a tremendous amount of education. I think it's always best to be honest with your patients, honest with your kids. Kids only hear what they're ready to hear. I think I shared a really intimate story of my son that I won't share on this, but you know, when kids are ready to hear it, they're going to, they'll ask, and you just have to answer them honestly and meet them where they are. They don't, especially with ALD, they're going in and getting their blood drawn, you know, every 6 months. They're getting their MRIs every 6 months. They're going to ask. They're not, like, at some point they're going to say, why am I doing this? And when they're 5, just like Dr. Eichler said, you have a boo-boo. We're looking for a boo-boo. We want to make sure you don't have a boo-boo. When they're 15, you need to be honest, like with it when they're asking that question, and just say, listen, there's a really serious consequence that can come up. And they may ask younger, at 10 or 11, but they'll ask when they're ready, and you just have to meet them where they are, I think.
Thank you.
Yeah, maybe give you got this story. So we had a patient with a different disease, Duchenne, whose parents didn't want to tell the family, or didn't want the child to know what his diagnosis is. And I think he was around 14, and you know, we meet with them on their own. And I remember he said to us, don't tell my parents. I don't want them to know. I know I have Duchenne. I Googled it. And I just have a few questions. And so all it really accomplished was making it that home wasn't a safe place to talk about it, and everyone was worrying on their own. And it was heartbreaking, right? Because this kid knew, and he just didn't have any place to ask that he felt comfortable with.
So I would argue in that scenario to try to talk to the kid about talking to the parents. I mean, we have this discussion. Right. We have this discussion when it's like the sex and drugs sort of things that the kids may disclose it to us, but then we talk through it with them and like, okay, how are we going to talk about this with your parents? Do you want us to be in the room? But I think having open discussions from the beginning is helpful. I have had situations, though, where parents have not wanted in that situation, and I really just try to encourage them to open up to the kids. Sometimes parents aren't ready themselves to accept it, and that it's often the parents aren't ready themselves for it. I find kids to be incredibly resilient and really open to hearing the discussions, but those are really hard discussions to have, and we have social workers in the room. You know, there are many people who can have those discussions. I once had a parent come in. It was a different genetic condition, and they didn't want the child to know. And I kept talking about it, and the parent came in, and I walked in the room. I told her in the car on the way here. Now you tell her what it is. I was like, Okay, let's have this discussion. Everyone does it when they're ready, but I think it's easier if the kid asks and you just answer honestly. Yeah. Okay.
Hi, I'm a mom to two MLD boys. So, two parts. One, I did not tell my youngest son that he had MLD until it came up one day. We were at Hunter's Hope Conference, and he asked me why all the, because every year we announce who's there, who's not there, and who's an angel and who's not an angel.
Yeah.
And he said, why are these children dying? So then we sat him down and we told him because it was the time and the place. Because MLD doesn't define us. It's part of our family, but it doesn't define us. So I think to each his own when you're ready to tell your child. And two, you touched on briefly that guardianship. I think that parents, well, not that I think, I believe parents should look into their child, just because they're 18 doesn't mean that they're an adult. Because like my youngest son, I never thought I would need guardianship until a doctor brought it up to me. And he's very verbal, can he make his own decisions medically? Probably not. So it's just, I think you need to establish that with your doctor and make sure that they have the medical notes, so when the time comes, you have that in place.
Yeah, it's really important. So it's actually one of our questions. If you have, for us with our built-in question set, if you answer this child's not developmentally able to do the transition process and answer questions, the next thing is you need to talk to our social worker about legal guardianship, and you need to bring this up with the family. So it's like a prompt for the provider seeing the patient to be able to say that.
So I think you need to talk to our doctors in New Jersey, because we don't have
Okay.
this transition thing.
Can I
And
tell
I have
you,
a
we're
son
all, no, you're right.
And I have
think,
a son who's turning 22, and
Yeah.
each doctor had told me, it's time to go now, even though I don't want to, but
Yeah.
but
Yeah.
they didn't give us a transition.
I would also say that if you have a son, you described your younger son as being perfectly capable of making his own decisions. Having that discussion, though, about who is going to be your medical proxy, and
Right. No, and
those
he-
things are
yes.
important too.
No, I
Yeah.
don't think he can make his own. Like,
Okay.
and he's,
Oh,
yeah,
okay.
yeah.
I'm
But
sorry.
I'm saying, like, other people might think because he is verbal and, he has no problem communicating, but.
Yeah. I do, this transition process, I mentioned, they started there was a policy statement in 2002, but honestly, in the pediatric world and the young adult world, this is something that has been a gap in care that we know of. And there are a lot of people who have been very thoughtful in the last decade about trying to implement it. Like I said, in my world in endocrine, it's because diabetes takes up so much. We've really put a lot of resources into diabetes, but we're recognizing, hey, this is working for diabetes, but we have a lot of kids with other endocrine conditions that they need long term. So I don't think your doctors, even the policy statements came out when a lot of us were still either in training and weren't included in our training. I never got any formal education on this. The education I've gotten has come through extra learning that I've done since I completed training. The same with quality improvement too. It all came later.
For the record, I do love my doctors, so.
Okay, good.
Just a note.
Good.
So I guess my question would be is how are you going to make sure that families don't fall through the loop? I personally had terrible experience. I live in Pennsylvania. We were just kind of thrown doing the guardianship like 2 months before my son turned 18. And when he turned 18, he had an episode, he stopped breathing. I was like, the doctors were like, well, you can't, he's 18, it's gotta be him. So he had to like sit there and nod his head saying mom can have permission. And then, when he did crash, yes, he was older, but his body was small. And they put him into the adult PICU, and the intubation kit didn't even fit him. They had to code for a pediatric intubation kit, so it even took longer to do that. And I just think that maybe that's something that could be put into consideration too, because just because they're a certain age, you know, their body size is a lot smaller. Another thing, and I'm going to say this for my son because this is something that he really, really, really wanted changed. So when he was put over into the adult side, there's no color. Yes, I get you don't, maybe not like the Dora the Explorer cars, but you know what, put some color over there. I'm an adult, I love color, it makes you happy. All the rooms don't have to be gray and, you know, eggshell white that are just gloomy.
Yeah.
He didn't like that. That's, you know, that's scary. So that's
No.
just something I think hospitals should take into consideration. Bright colors make you happy. So.
I'm with you, and I wish, I've been very fortunate to have some adult endocrine colleagues who have taken on some ownership over the transition process and really partnered with us. I think that this is where, as a community, we can come together and talk about exactly what you're saying. Like, how do we prompt it so the guardianship discussion doesn't happen as it needs to happen, that it happens a year beforehand, or it's a process that's just thought about and discussed. I'm now at least having that thought in my head when I see that prompt come up at 12, that, oh, this is probably something we're going to have to plan out for this family, as opposed to waiting until they're 18 and there's a crisis. So I 100% think that's great. Okay. Thank you.